Here are 10 Puerto Rico Medical Board-style clinical vignettes focused on pathophysiology of common diseases, with 4 answer choices and explanations. Pathophysiology of common diseases, clinical vignettes. 1. Myocardial infarction, ischemic cell injury. A 58-year-old man with hypertension, diabetes, and hyperlipidemia experiences crushing substernal chest pain that radiates to his left arm. ECG shows ST segment elevations. Which pathological process leads to cell death in this condition? A. Liquefactive necrosis. B. Coagulative necrosis. C. Fat necrosis. D. Caseous necrosis. Answer B. Coagulative necrosis. Explanation: myocardial infarction leads to ischemic injury, triggering coagulative necrosis, characterized by preserved cellular architecture and loss of nuclei. Type 2 diabetes mellitus, insulin resistance. A 45-year-old woman with obesity and sedentary lifestyle has chronic hyperglycemia despite normal insulin levels. What is the primary mechanism of insulin resistance? A. Increased GLUT4 expression. B. Decreased insulin receptor sensitivity. C. Overactivation of glucagon receptors. D. Beta cell hyperplasia. Answer: decreased insulin receptor sensitivity. Explanation: obesity-associated inflammation and lipotoxicity impair insulin receptor function, leading to insulin resistance and hyperglycemia. 3. Chronic kidney disease, nephron loss. A 67-year-old man with long-standing hypertension and diabetes develops progressive renal dysfunction. Which physiological adaptation occurs in surviving nephrons? A. Increased glomerular filtration in remaining nephrons. B. Increased renin secretion. C. Decreased sodium reabsorption. D. Increased erythropoietin production. Answer: A. Increased glomerular filtration in remaining nephrons. Explanation: surviving nephrons undergo compensatory hyperfiltration, increasing intraglomerular pressure and accelerating disease progression. Chronic obstructive pulmonary disease, COPD. Emphysema pathophysiology. A 70-year-old man with a 50-pack-year smoking history presents with progressive shortness of breath and barrel chest. What is the primary mechanism of alveolar destruction in emphysema? A. Increased alveolar surfactant production. B. Excessive oxidative stress. C. Neutrophil elastase-mediated breakdown of elastin. D. Hypertrophy of bronchial smooth muscle. Answer: C. Neutrophil elastase-mediated breakdown of elastin. Explanation: cigarette smoke activates neutrophils, increasing elastase activity, leading to elastin degradation and alveolar wall destruction. 5. Alzheimer's disease, neurodegeneration. A 74-year-old woman is brought in by her family due to progressive memory loss, confusion, and personality changes. Autopsy findings would likely show which characteristic brain pathology? A. Tau protein neurofibrillary tangles and β-amyloid plaques. B. Lewy bodies in the substantia nigra. C. Prion protein accumulation. D. Increased dopamine in the prefrontal cortex. Answer: tau protein neurofibrillary tangles and β-amyloid plaques. Explanation: Alzheimer's disease is characterized by β-amyloid plaques and tau tangles, leading to neuronal dysfunction and cognitive decline. 6. Systemic lupus erythematosus, SLE, autoimmune mechanism. A 26-year-old woman presents with fatigue, joint pain, and a butterfly-shaped rash on her face. Her blood test is positive for anti-nuclear antibodies, ANA, and anti-dsDNA antibodies. What is the primary pathophysiological mechanism of SLE? A. T-cell-mediated destruction of pancreatic B cells. B. Autoantibody-mediated immune complex deposition. C. IgE hypersensitivity reaction. D. Granulomatous inflammation. Answer B. Autoantibody-mediated immune complex deposition. Explanation: SLE is driven by autoantibodies forming immune complexes, leading to systemic inflammation and tissue damage. 7. Peptic ulcer disease, gastric acid and H. pylori. A 52-year-old man presents with burning epigastric pain that improves with meals. Endoscopy reveals a duodenal ulcer. What is the primary mechanism of ulcer formation? A. Excess mucus production. B. Increased prostaglandin synthesis. C. Helicobacter pylori-induced mucosal damage. D. Pancreatic enzyme deficiency. Answer C. Helicobacter pylori-induced mucosal damage. Explanation: H. pylori infection disrupts mucosal defense, increases acid secretion, and promotes ulcer formation, particularly in the duodenum. 8. Hyperthyroidism, Graves' disease mechanism. A 32-year-old woman presents with weight loss, heat intolerance, and exophthalmos. Blood tests show low TSH and high free T4 levels. What is the underlying mechanism of this condition? A. TSH receptor stimulation by autoantibodies. B. Pituitary adenoma secreting excess TSH. C. Thyroid hormone resistance. D. Iodine deficiency. TSH receptor stimulation by autoantibodies. Explanation. Graves' disease is caused by thyroid-stimulating immunoglobulins, TSI, activating TSH receptors, leading to excessive thyroid hormone production. 9. Osteoporosis, bone remodeling imbalance. A 70-year-old postmenopausal woman is diagnosed with osteoporosis after a low-impact hip fracture. What is the primary pathophysiological mechanism? A. Increased osteoblast activity. B. Increased osteoclast activity due to estrogen deficiency. C. Decreased parathyroid hormone secretion. D. Increased bone mineralization. Answer B. Increased osteoclast activity due to estrogen deficiency. Explanation. Estrogen inhibits osteoclasts. Its deficiency leads to increased bone resorption and decreased bone mass. 10. Hypertension, renin-angiotensin-aldosterone system, RAS, dysfunction. A 55-year-old man with chronic hypertension presents with headaches and left ventricular hypertrophy. What role does the RAS play in hypertension pathogenesis? A. Inhibition of sodium reabsorption. B. Increased aldosterone-mediated sodium retention. C. Vasodilation via angiotensin II. D. Decreased renin secretion. Answer B. Increased aldosterone-mediated sodium retention. Explain. RAS activation increases aldosterone, promoting sodium and water retention, which raises blood pressure. Key takeaways for pathophysiology of common diseases: myocardial infarction, coagulative necrosis due to ischemia, diabetes mellitus, insulin resistance impairs glucose uptake, chronic kidney disease, nephrons compensate with hyperfiltration, COPD emphysema, neutrophil elastase destroys elastin, Alzheimer's disease, β-amyloid plaques and tau tangles cause neurodegeneration, SLE, autoimmune immune complex deposition leads to systemic inflammation. Peptic ulcers. H. pylori weakens mucosal defenses, leading to acid-induced ulcers. Graves' disease. Autoantibodies stimulate TSH receptors, causing hyperthyroidism. Osteoporosis. Estrogen deficiency increases osteoclast activity. Hypertension. RAS activation increases sodium retention and blood pressure. Would you like vignettes on another system or pathology?